Good morning. I want to thank you all for coming today. I want to welcome you all. I'm Dr. Vincent Matthews. I'm the Superintendent of Schools for the San Francisco Unified School District. I want to thank the Mayor, our School Board President Mark Sanchez, Dr. Grant Kovacs from the Department of Public Health for joining me today to share more about our current plans for the San Francisco Public Schools. We have 132 preschool through 12th grade public schools in San Francisco serving over 56,000 students. We recognize how challenging the COVID-19 situation is in our city, including the families, students, and staff in our schools. People are worried and uncertain. Today we want to share our planning at this time as it relates to the schools. And to be clear, plans could change as the situation unfolds. First of all, I want to say the safety and well-being of our students, staff, and their families is front of mind, but this is an evolving situation. Some believe that closing all schools is necessary to reduce further spread of the novel coronavirus. We have given this idea of preemptive school closures careful consideration. At this time, the experts at the San Francisco Department of Public Health do not recommend broad public school closures, as schools are essential service with multiple community benefits, and children have not been shown to be a high-risk group for serious illness at this time. After careful deliberation and hours of consultation with the experts at the Department of Public Health, the Board of Education unanimously and I agree with the benefits of keeping our schools open at this time outweigh the benefits of a citywide closure. This could change with new information, and we will continue to work with public health and state officials as we make decisions that impact us all. Families know what's best for their children, and we will honor your decision to keep your children home from school at this time. Absences will be excused. Parents, if you are keeping your children home, please contact your child's school to let us know. We are taking preventative measures in response to the information from public health. Staff who are at higher risk of complications from COVID-19 may need to stay home, and we have asked them to work with their medical provider to make this determination. We will honor all sick leave requests for any staff who needs it. We're working with teachers to provide educational activities in the event of students having prolonged absences. In response to public health recommendations to limit social contact, events that bring large groups of students, adults, and community members together have been canceled, including student athletics. Within our buildings, custodial staff are cleaning common and high-touch areas multiple times a day, and we're providing resources, supplies, and time for students to wash their hands for 20 seconds with soap and water regularly. Please help us, parents, by keeping sick children home. If students exhibit illness or COVID-19-like symptoms, we will contact a parent or guardian to pick up that student immediately. We are exploring how to provide online distance learning in the event of a prolonged absence or school closure. We will not implement an online distance learning model unless our district can ensure that all students will have equal access to learning. We have a diverse student population, and some of our students do not have regular access to technology or the internet. We have procedures in place of a school or district closure, including providing lunches to students who qualify for free and reduced lunch. Our goal is to keep our doors open as long as possible, as the health and safety of our students and staff is foremost. And with that, I'd like to turn it over to the mayor of our great city, Mayor London Breed.
Thank you, Dr. Matthews. And along with Dr. Matthews, the superintendent of our school system here in San Francisco, and school board members, we're also joined today by the director of the Department of Public Health, Dr. Grant Kovacs, as well as member of the Board of Supervisors, Aaron Peskin. We know that this has been a very challenging situation because we hear about various reports on a daily basis. And I want to just say, because I've been asked this time and time again, are we overreacting? And my answer to that is, here in San Francisco, we are doing everything to make sure that the facts the data, the information based on the health experts of the Department of Public Health are taking front and center in how we communicate with the public and how we make decisions. We think that the misinformation that consistently gets put out there gets in the way of what is happening to do, what we need to do in order to address this real challenge. You know, I want to ask the residents, please don't panic. Please listen to the information we're provided, and please continue to work with us so that we can rise to the occasion and meet the challenges we know all exist in our city. This is about protecting public health. We are prepared to address this, and we want to make sure that the information we provide is being taken seriously and is being used appropriately. I appreciate the members of the school board as well as the school district and their decision to listen to public health experts and keep our schools open. We know that childcare could end up being a challenge for parents. We also know that sometimes this is the only place where many of our kids have access to meals and facilities and other places where they can even wash their hands. We have to think about, you know, the impacts on young people, and so I fully support that decision, along with the most recent decision that we made here in San Francisco to cancel all major events that exist in the city with over 1,000 attendees. We know that this is necessary because right now it's about mitigating the impacts. It's about making sure that we reduce and eliminate the spread. And we have followed in every single instance, in every decision that we've made, it has come based on the direction of our public health experts, which are some of the best in the world, right here in San Francisco, advising us as this virus progresses. And so I appreciate the work that the media has done to get the word out in order to make sure that accurate information is provided, that we're consistent in our messaging, that we are doing preventative strategies around making sure that we reduce or eliminate the spread. We know that this will have significant economic impacts, which we are also dealing with, but the most important thing at this time is public health. And at this time, I want to ask Dr. Grant Colfax to come forward and provide more information, more suggestions, the most recent information on what is happening now in San Francisco as it relates to the coronavirus. Dr. Colfax.
Thank you, Mayor Breed. Good afternoon. I am Dr. Grant Colfax, Director of Health. I am glad to be here today with the Mayor, Superintendent of Schools, and the School Board President, because we are united in our goal of keeping our community's children, families, and workers safe. In this rapidly evolving situation, we continue to learn more every day about the coronavirus and COVID-19. We know today that this virus has the greatest likelihood of harming elderly people and those with underlying health conditions and chronic illnesses. But in children, the illness has been very mild. They either remain asymptomatic or experience mild flu-like symptoms. In fact, in China, the epicenter of the outbreak, from what we know now, at this time, there have not been any fatalities in children between the ages of 0 and 9. This is helping us shape our thinking about schools and how to handle the question of closure. Schools are an essential service and crucial to our communities. That said, no one, neither staff nor students, should attend school if sick, and I cannot emphasize that enough. If you have a child with chronic health conditions, consult your healthcare provider about school attendance. And we know that schools are working hard to ensure everyone's safety, and we are partners at the health department in that effort. As much as possible, children should be able to continue with their education and normal activities. fortified by frequent hand washing. If there is a confirmed case of coronavirus, COVID-19, at a school, we will work with the school and the district to determine the best measures based on science and data with regard to potential school closure. We are still not certain that repeated closures are a useful intervention in the long term. Focusing on each individual case, you are going to pay less attention to the risk that is out there in the broader community, especially on the vulnerable populations I mentioned. And as we all know, the virus does not stop at the schoolhouse door. All of us have a role to play in decreasing the opportunities for the virus to spread. In San Francisco, we know the virus is here. Our goal going forward will be to attempt to decrease how rapidly the virus spreads among our community and doing everything we can to protect vulnerable populations. As we increase our access to testing, so will the number of confirmed cases. It is only a matter of time before multiple students and staff members at SFUSD schools have a diagnosis of coronavirus COVID-19. Given the current facts, coronavirus is in the community, so kids bring it back to school and vice versa. The evidence is mixed on whether closing all schools for a short period of time would make a significant difference. And this is what this is about, making a significant difference in slowing down the virus spread in our community. Especially in the Bay Area, where many people live their lives in more than one county, school closures is not convincing at this time as an effective intervention. And again, as the mayor and others have said, this is a rapidly changing and evolving situation. We follow CDC and state health department guidelines, and we consult regularly with regional health officers on this very topic every day. If our whole region chooses to coordinate around an approach that further restricts social contact, then closing schools could be part of a future, more comprehensive plan for slowing the spread of the virus. To be ready for that possibility, we recommend that all schools develop a plan for countywide school closures, and families should prepare for potential closures. We know that schools have many considerations of their own about what is right for their students and the communities they serve. We advise that any school that chooses to close to give families enough time to make arrangements for childcare during the closure and to try to avoid leaving children with older relatives who are more vulnerable to the impact of the virus. We encourage schools that close to use the time to plan, prepare and train staff about how to educate students on precautions and the facts of the coronavirus. An informed community is a safer community. SFUSD is doing a great job of following our guidelines and working with us for minimizing non-essential activities and ramping up health education, cleaning, and other key preventative measures. I am confident that by continuing to work together, we can respond effectively to this dynamic situation and unite to protect the health of all of our community. Thank you.
And now I'd like to introduce to you the president of our school board, Mark Sanchez.
Thank you for being here. I'd like to recognize my colleagues on the Board of Education, Stevon Cook, Jenny Lamb, and Fauga Maliga. We all stand in solidarity in dealing with this issue. I want to thank the mayor, superintendent of schools, and Dr. Colfax for working with us to ensure that our students are safe both in and out of school. Beyond providing education for our students, public schools are the access point for critical social services for thousands of our families. Many of our students' parents are on the front lines of the COVID-19 response. By keeping our doors open, we help ensure they continue to work and contribute to this health of our community. The public schools for San Francisco play a critical community role in providing stability and safety for our city. We have told families they can keep their kids home for health reasons without penalty. But we know that for some children, if they are not at school, they may be unsupervised or needing to be cared for by their grandparents, who are the most vulnerable. It also likely comes as no surprise that our schools have a shortage of funds for all the additional costs related to COVID-19, such as cleaning supplies and custodial support. In addition, the cost of substitutes to cover for vulnerable staff members who can't come to work for a period of time and the possible cost of equipping all of our students with distance learning capabilities is a factor. We would welcome relief from the city and support from our community, particularly those who are fortunate enough to acquire massive wealth. I also want to thank Mark, why am I Salesforce? Oh, sorry about that. Mark Benioff for contributing to our district, and he continues to do so. Our community values are tested in times like these. We must continue to be united and support each other as the coronavirus disease becomes more widespread. In schools, we continue to demonstrate compassion and care as our greater community navigates the global health situation. Thank you very much.
Thank you. And I just want to also add, in every time we provide an update, we want to make it clear that from the very beginning back in late January, when this was, of course, brought to our attention, we have been preparing for this situation, first and foremost, to ensure that we protect the public health. And I want to be also clear that San Francisco has been through challenging public health crises in the past. The H1N1, SARS, the HIV epidemic, and we have come together as a city with some of, as I said, the best public health experts anywhere in the world, and we have gotten through it. This will be a challenging time for us, but we will get through this by working together, by providing factual information, by following the guidelines and the suggestions that continue to get recommended by our Department of Public Health. And I appreciate, again, the school board and the work that they are doing to ensure the safety of our children all over San Francisco, as well as the Department of Public Health and the work that they have done to stay on top of this issue on a regular basis. And as situation has evolved, you, the public, have been the first to know as soon as we are able to confirm information and make recommendations to address the situation. So again, thank you all so much for being here, and I want to turn it over to Dr. Oh, okay. Okay.
Just to clarify for parents who are sort of might be confused about the city's policy to cancel events with over 1,000 people and yet keep schools open where in many cases there's more than 1,000 students at the school. I think we said nothing. Can you clarify that?
So for schools, we know that schools are an essential service. So I believe the 1,000 is for non-essential. So that the difference is between essential and non-essential. So that's why the schools are remaining open, because we believe we know these are essential.
The process for deciding to close schools, whether it's SFUSD or yesterday, the San Francisco Archdiocese, the independent schools closed yesterday, does that come from EPH? Do they report an illness to the family members, and then do you guys tell the school to close, or is it the school's decision to close?
So we work with schools when there is a case diagnosed that's potentially related to the school. We follow every situation is different. So based on what we know about the exposure, we make recommendations to the school about next steps. The Archdiocese, I can't come on that. They did not consult with us before the closure, but we are working with schools as much as possible to make the best decision based on facts, data, and science. Thank you.
Related to the Archdiocese, I spoke to the president yesterday, who confirmed it's one of their students who has coronavirus, also parents who are school. I understand the two juvenile cases in California, because of privacy laws, we don't know a lot about them. But all of the questions that I'm getting from parents in the San Francisco community is that, oh my gosh, these are two young people, how are they doing? Is there any information you can tell us? I know you talk about how young people in China have fared well with coronavirus.
I can't comment specifically on those individual cases. Again, I would follow the data and the science, which shows that most children, the vast majority of children, have mild symptoms and recover well.
Wondering if you could address the possibility that a child could become infected, and if they cohabitate with their grandparents or with somebody who's in a higher risk group, is that one of the concerns, and how does that calculate into your decision to keep the schools open?
Right, well, that's exactly it. We're trying to balance the risk and benefits of all these large interventions, and that's exactly one of the concerns that has been raised across the region and in our conversations with our state partners, which is if there was widespread school closure at this time, we would be concerned about the effects of unintentional, or the fact that the consequence could be exposure to high-risk populations that we know, based on the data from China, and unfortunately now the data from King County in Seattle, are very high risk for morbidity and mortality in that situation.
How are you educating the parents on how and what's going to happen next?
So we continue to, we email all parents, we send emails, text, we send phone messages. We also ask parents, please continue to look at our website. It's updated daily now on the changing situation and what we're doing. But we continue to reach out, so we're pushing out information, as well as we're asking parents to continually go to our website to get the latest information. We expect in the next few days to have a video up with one of our DPH colleagues to answer more parent questions.
You said it's only a matter of time for multiple students that have to be diagnosed with coronavirus. Given that, isn't it likely that they're already off the have it, they'll have to be tested, they'll positive, and it's likely to spread further since the schools are staying open?
It's possible, and that's why I emphasize that if staff or students are sick, that they should stay home and consult their healthcare provider.
Does the city have a plan to assist schools financially? Is there anything in place?
To do what?
Specifically
To do what?
To help with cost of substitutes or extra cleaning supplies or anything like that?
Well, just to be clear, the city does provide a significant amount of money to the school district already, and as a result of this virus, our economy is going to have a significant impact, not just on the amount of money that we're going to be spending on medical-related challenges to reduce the spread, but also the loss of the conventions, our businesses, employees. I mean, we're talking about a significant financial impact, and so we at this time are analyzing exactly financially what that would mean for our city budget this year and next, and what are some of the investments and things that we can do to help mitigate the impacts on not just our schools, but our entire city. This is going to be very challenging for all of us, and it's going to be important that we work together to address it.
Bringing a stimulus package to the city?
You know, we hope so. I sent a letter to the vice president who's overseeing this issue just to address, just the protective gear and the testing, the test kits and the things that we need to make sure that we are fully equipped here in San Francisco to handle this situation. But we're not going to wait for the federal government and a decision to be made. We need to protect our residents now and hope that we get reimbursed or get some financial assistance sooner rather than later, but we are already moving forward in that.
Your comment said that they have even one case at the school, they will close all the schools in the district. You said that even if this happens in San Francisco, they don't go that way at this point.
Let me be very clear. This is an evolving situation. We're working with our other neighboring county partners. At this time, we are not planning widespread school closures. That could change on a number of factors that I will not speculate on right now, but I just want everybody to hear that as of now, there is no plan to close schools for the reasons we just talked about.
Schools?
Yes, yeah. How has attendance dipped, if at all, and is there any assurances from the state that that won't affect the funding mechanism they
So we're still monitoring attendance. There's been a slight dip at this point, when we understand that, and as we've said, if families, they make the best decisions for their children. So we're totally understanding of that and have excused absences. To answer both of those questions, I was in a meeting with Governor Newsom and the State Superintendent of Public Instruction, Tony Thurmond, on Monday, and they are aware of the needs that are coming. We all know that this is going to be an economic hit to the state as well as the school systems, and so they are aware of that, and there wasn't an answer to the question of that as bluntly as, you know, is there funding going to be there, but they're aware of the situation and starting to look because they know that funding needs are going to be there.
Just sort of to get more clarity, Dr. Colfax, on the evolving situation, if you get a coronavirus case in an SFUSD community, whether it's a student, a parent, or a grandparent, can you talk to each of those cases, or just close the school, close the whole district with how their archdiocese?
So again, at this time, it's based on a case-by-case basis, depending on the exposure, the population of the school, the circumstances. So it's really not appropriate to make a blanket statement in response. It's going to be on a case-by-case basis at this time. I can't comment on specific cases at this time.
Anything else on schools? Yeah, so if you
Real quick, some schools have more than 1,000 students. So can you talk a little bit about that?
So, as we said earlier, that what schools, so the 1,000 is for non-essential events. Schools are essential, so that's the difference between the two.
Thank you.
Thank you. Okay, so now.
So as you all know, last week I put out a directive to provide guidance to the public around large-scale events with recommendations to not only postpone large-scale events that are non-essential, but if there are events that people are choosing to move forward with, to provide hand sanitizer, washing stations, tissue, and things that could help with those particular events. And what we also realize is that it's important to, as quickly as possible, stop and reduce the spread of the coronavirus as a whole in the city. And the recommendations that we made weren't necessarily taken by everyone, and as a result, we have decided to take that a step further. And putting a moratorium on large-scale events of 1,000 or more people as it relates to trying to mitigate the impacts of the virus on communities throughout our city, and especially, again, some of the most vulnerable populations. And this was the strong recommendation of our Department of Public Health, and as I said time and time again, this is an evolving situation, and every opportunity we have to make changes that are going to protect public health, including this moratorium, we will do exactly that. And the recommendation is that we do that at this time, and so it's effective immediately. And our hope is that this will help to make it clear to everyone exactly what we expect as it relates to large-scale events. I'm sorry, I can't see. Yes. So the first part, in terms of is there legal weight, there is legal weight, and so we did this in consultation with the city attorney's office, and as soon as it was confirmed that we could issue this directive, we did so, and we made it effective immediately. And I'm sorry I didn't hear the second part of your question. Well, I would just say that we made it, it was a recommendation. And then we as a city followed that recommendation, and we had expected everyone to follow the recommendation. It didn't happen, and as a result, we took it even further. I will say that the Warriors did what they wanted to do, and they didn't follow the recommendation, but they were well within their right to do what they did, and that's why it was important that we provided definitively that this should not be happening, so that we could provide them with the guidance to basically make it clear to them that this is not something that should have been allowed.
Address how many test kits that you have. Are you testing everybody that you want to test? Are you running out of test kits?
So specifically with regard to the question of testing, we started testing locally Monday. We've upscaled our testing as have other healthcare providers, and I'm very pleased to say that we are now using other private labs to be able to scale up testing. We will also start, so other healthcare providers are using those other labs now to scale up testing, and we will start doing that across our public health network as of Thursday. I also want to emphasize, though, because there are so many requests for tests right now, we really need to focus on the people who are most at risk for poor outcomes from this disease, and we are prioritizing testing for people who are in the hospital, for people who are close contacts of people who have a confirmed COVID-19 infection, and for healthcare workers, because we must also protect our healthcare workforce. There is still not on-demand testing in San Francisco. If people want to explore being tested, they need to consult with their healthcare provider, who can then follow DPH recommendations and steps as to whether a test should be done at this time. We have 14 confirmed cases of COVID-19 in San Francisco at this time. I don't have data to share on the number of tests done throughout the city at this time.
Rick, can you summarize your discussion with the Warriors, what took place and who you met with?
So basically, the conversation was really, you're going to need to cancel your games and events, and it was like, okay, and then it happened. I mean, it wasn't much to it. I think, again, we put out a recommendation, and in that recommendation, we provided ways in which people could be safe in these large-scale events. And the Warriors followed those guidelines and made a decision to continue anyway, because it was not a requirement. Now it's a requirement. They are on board and fully supportive, and this is where we are now.
Have you had any discussions with the NBA at all? I mean, were they involved in this?
But I will confirm that I've spoken to the PGA, and they said that the information that went out was rumors, that they were looking at an alternative location. They are committed to San Francisco, and again, this is an evolving situation, so a decision for an event that's happening in May probably won't occur this early in advance. So they are committed to San Francisco, and we are hoping that we get through this and we see the light at the end of the tunnel before or sooner rather than later. We don't know when that's going to be, but I do know that we will get through this.
Is there something that could be allowed to go magical about the facts and say fill more, I think it was 1,100 people, be able to go through 2,000. If you only allowed 900 people, would that okay?
Yeah. So the scientific consensus is that banning large events such as sporting events, concerts, and other non-essential events has a public health impact in terms of these sorts of diseases. There is not a specific cutoff of a number that is scientifically valid at this time. That I would emphasize that with regard to vulnerable populations, people over the age of 60, people with chronic diseases, including kidney disease, diabetes, immune disorders, that they restrict their movement and engagement in large events and smaller events. The CDC issued guidance in the last 24 hours to reduce those engagements to numbers less than 10.
Real quick, you guys have 2 more cruise ships scheduled to come in on the 19th and the 20th that I know of. What's the discussion about that, and what's planned?
So, as you probably know, the decisions around what happens with those cruise ships are the state government working in collaboration with the federal government. We are, of course, a part of the discussions, and we stand ready and prepared if necessary. If a cruise ship docks here for whatever reason, we will alert the public. We will communicate the specifics of what we think is happening as it relates to the people who are on the cruise ship. We will set up whatever necessary things that we need to set up to address it, just like they're doing at the Port of Oakland. But at this time, we have no information confirming whether or not something will be docking in San Francisco in the near future.
This is non-essential gatherings and public gatherings. What about private, like maybe 1,000-person wedding, for example?
So at this time, if an event exceeds that number, we would strongly recommend canceling or rescheduling that event, and that people with the vulnerable populations I just went through do not attend. Thank you.
Something changed between yesterday and today, because yesterday there was a Warriors game, and today, Thursday, they won't be able to be something that happened that you guys say, okay, maybe now we'll switch.
We are continuing to evaluate the situation on a regular basis. We're making informed decisions based on the data, evidence, and facts. We are obviously monitoring the situations both globally and across the country, and in consultation with other health experts and so forth. That we are making the most up-to-date recommendations and changes. I would emphasize that we did put out a recommendation with regard to canceling these events. As the mayor has said, that didn't happen in some cases, and so now we feel that it is imperative to protect the public health to make this in order. Thank you.